Assalamu alaikum. Welcome to Parenting Hour. You're tuned into 93.5 Unity FM and you're with me, Kathleen Roche-Nagi, for the next hour. Alhamdulillah, we've got a very packed hour again for you today. So do keep tuning in because we want to you to know all about your own health, and we're doing a series about public health at the moment. And what does that mean and the relevance of it to you and to your families. So it's really important to tune in to understand this effectively. If you have a question that you'd like to ask us, please do email the studio in at studio@unityfm.net, or if you want to talk to the doctor or any of the doctors over the next few weeks, you can telephone Unity FM and they will pass on the message to the relevant doctor for you. And of course you may not remember it, but the number for Unity FM is 0121 772 8892. That's 0121 772 8892. So we're really happy here on Parenting Hour to be bringing you this series about health and the importance of looking after your health and what is public health. And it's great to have a series of different topics coming up over the next few weeks. So while today we're going to be focusing on TB, which is really important to know about TB, and when you mention TB you might just remember when you were young that mark around your hand, those tests, those circles, and are they rising or not rising? Well, we'll find out today what does that mean, what it's all about. And over the next few weeks we're going to be talking about health checks and what are they and who are they for, and then a bit more about women's health and a bit more about men's health. So do keep tuning in because each week there'll be something different. Experts in the studio here ready to answer your queries or give you more information, inshallah. Alhamdulillah, today in the studio I've got Dr. Ankush Mittal with me, and he is from Public Health UK, Public Health England.
Well, Public Health in Birmingham.
Public Health Birmingham, great. Okay, welcome to the studio. Thank you. I know you've come before and you've been part of our talks before on public health, which has been very, very relevant. And thank you for making the effort for coming today to educate and inform and let people just know the basic and the more complicated issues of TB, because we hear a bit about TB. We hear about it on the radio. We hear about it on TV. It was something we used to hear a lot about, and every now and again there's waves that comes in and say, oh, you should be doing this or you should be preventing this, and people get a bit confused. What is TB? Because it sounds like a big illness. Is it a big illness? What is TB? Can you explain a little bit to us about
Sure. Well, thank you so much, Kathleen, for inviting me again onto the show. I really do value this opportunity to talk to your listeners and teach them a bit more about TB.
Thank you. And before we go into TB, maybe you can tell us a little bit more about public health actually first, and then we can go into the TB bit.
Sure. Well, I've come from Birmingham City Council and I work in the public health department there, and I trained as a young doctor quite a few years ago and came into public health because I was really interested in strategy. I think it's really important to treat people, and our clinicians do really valuable work, but it's also really important to think strategically about, well, actually in a population, how do you control disease and prevent illness? There is that saying that prevention is always better than cure, and one of our hopes is that we can really prevent TB and stop it being a problem in the future. It's not easy. We've had TB in this world for hundreds of years. It's been around since ancient times, and it certainly was a disease that we didn't talk about as much maybe 30, 40 years ago. TB rates in England were really low. Over the last 2 decades, however, TB rates have gone up. They're not necessarily going up over the last few years, but we do know the rates now are much higher than they were in the 50s and 60s. And that's for a range of reasons, and we can talk about that soon. But I would really like to talk about TB, first of all, just what TB is, and give people an idea of what we mean when we say TB.
Please do, because it sounds, I think, huge to people that may not know what is TB, especially when you say tuberculosis. It's a big word.
Absolutely.
And we've cut it down to TB, and what is this? Is this like a cancer? Is this, people might be a bit worried about, what is it?
Yeah. Well, I think most people have heard of TB, and the first thing to know is it's an infection. So just like, you've got coughs, colds, chest infections, you can have skin infections, TB is an infection. And I think a lot of people know TB as an infection that can affect your lungs, so it can cause a cough. Now, interestingly, TB is one of those bacteria, one of those bugs that can actually infect any part of the body, not just your lungs. So it is a very complicated bug. But certainly the type of TB that we worry about the most is the type of TB that affects your lungs, that can cause a cough. And that's a type of TB that can be passed on from one person to another. And that's the sort of TB that I want to talk about today, because I think it's very important that we crack down on this type of TB. Because ultimately that's the type of TB that can spread from one person to another and cause a bigger problem in the community.
Right, so this is a bug, a bacteria, you're saying, that can be passed by coughing, is that right, in the air from one person to another?
That's right.
Right, okay.
So the best way for us in public health to stop TB being transmitted from one person to another, passing from one person to another, is by making sure that if somebody has TB, they get diagnosed quickly by their doctor and they get treatment quickly. Because when you get treated, you can eliminate that bug from your system and reduce the risk not only to yourself but other people around you. And so our strategy really relies very heavily on, obviously, all our clinicians being well aware of what TB is and being able to diagnose it, which they are very good at. But it's really important that our populations in Birmingham are also aware of what to look out for. Because in the first place, they have to go and see their doctor if they've got the symptoms, for the doctor to know and diagnose it. So that's a really important part of our strategy. So what I'd like to do now is talk a little bit about what sort of signs and symptoms you can expect if you or someone you know may have TB.
Exactly, because a lot of people get coughs and maybe chesty coughs or bronchitis or whatever, and they may think they have TB after listening to this show. So how would people know the difference between a ordinary cough and cold and TB?
Yeah. Now, firstly, it's not always easy to tell the difference, especially in the early stages. And I would like to reassure people that TB isn't that common. Certainly it's more common in Birmingham than a lot of other cities in England. But most of the time, if you've got a cough or you're feeling a bit chesty, it's likely to be something that could pass and come and go like a common cold. I think we should all start thinking, if you've got a cough for 3 weeks or more, or things aren't getting better, then what is it? And TB is one of those conditions that doesn't tend to come and go after a few days. Once you get it, it sort of stays with you, and the cough and the symptoms can stay with you for many months. So certainly, if something's not getting better, it should raise your alarm bells. And if you've got a cough and it's lasted for 3 weeks, you should certainly wonder, why hasn't it stopped by now?
And what can I just ask you? What kind of a cough is that? Because sometimes we have a cough, but we're not all the time coughing, and it might come just every now and again, or it might come in the night time, or it might be first thing in the morning.
That's right.
How do we distinguish the cough for the 3 weeks?
Well, I think, again, the answer to that is it's not easy. So everybody's very different, and their bodies and systems are very different. TB can cause a cough that comes and goes, so you might have periods where you're not coughing much. But equally, some people may get a form of TB where they're coughing quite often. Some people may find the symptoms are worse at night, but not everybody. And I think the most important thing is, well, okay, fine, I've got a cough. Has it got better? Do I feel better? And how long has it lasted for? And certainly that idea around 3 weeks is something that's quite important. If something isn't resolving by then, regardless of how you're feeling inside, I think it's time to see your doctor. So that's one of the key messages. Now, some of the other symptoms that you get alongside the cough with TB might be useful to think about as well. One of the very common symptoms is night sweats. So people with TB may find themselves waking up in the middle of the night very, very sweaty. And that doesn't tend to happen with all infections. And certainly that nighttime sweatiness is something that may make you think, well, this is not your average infection. And that's something to be wary of. Also, you tend to get very high fevers with TB, and sometimes you can have a high and raised temperature. You can have that with other infections, but as I say, if you've got a cough that's not stopping, you've got a fever that's high, you're getting sweats at night, you're losing weight potentially as well, and you're not feeling hungry and you're very, very tired, you need to start thinking, is this, a common cough? Is it a common cold, or is it something more serious? So it really does come down to actually how unwell you're feeling and whether anything's resolving. And actually, your doctor will be able to guide you as well. Not everything you may suspect to be TB may be, but certainly if something's not getting better, the general advice is to see a doctor. And that's the most important thing. And I think I'd like people to think, well, if they've got somebody who's got a cough and it's lasted for a while, and they haven't seen anyone about it so far, and they're just sort of sitting on it and thinking, well, it might go. I'd really encourage them to, get that relative or friend of theirs to go and see a doctor, because ultimately only they can make that assessment of what this might be. And it may not be TB, but I think it's important to find out.
And that's any kind of cough, is it, to be clear on that? A
Absolutely.
tickly cough, a chesty cough, or a cough that comes every now and again.
Yeah, I mean, if it's something that you're not used to. I mean, we've got a lot of people who've got types of asthma where they're used to coughing, all season, and it's something that their doctor has already talked to them about, and they know why they're getting it. But certainly, if you're not somebody who's used to coughing, and you've got a new cough, or it's a different cough to what you're used to, and it's gone on for quite a while, 3 weeks or more, then you should be thinking, well, I don't know why this is happening. No doctor has ever explained it to me. And I think that's where you need to think, well, actually, I'm going to seek some advice on this. And then the doctors can arrange the appropriate tests, etc. And like I said, it may not be TB, but the strategy is about being cautious, being careful, and being proactive about our health.
Good, and we need to get in there early to be proactive about our health rather than leaving it and thinking, oh, it's nothing and I'm busy. And,
that's right.
It's just something I picked up. And people do tend to do this with their busy lives, put it on the long fingers,
Absolutely.
we say. And
Absolutely. And that's not just my opinion, and we do have evidence and research on this. We know in Birmingham about half the people who are diagnosed with TB are actually diagnosed more than 2 months after their symptoms started.
Right.
So I talk about 3 weeks as a sort of indicator of when you should worry. Well, actually, quite a lot of the times it takes over 2 months before we even find out someone has TB. And of course, in that time, TB can cause some damage to the individual who's got the problem, but also it could spread from person to person while they're not being treated. So it's not just a risk to the individual, but potentially a risk to others around them. So I think the key message for me today, I think if I could get one thing out of today, is to make people a bit more conscious about coughs in general, and be wary where a cough has lasted for a certain amount of time, 3 weeks or more, to think, actually, this isn't normal for me.
Yeah.
And to seek some advice.
Brilliant. You mentioned earlier on there that TB was on the rise in the UK, and Birmingham was more of an issue. So can you clarify that a little bit for us? Why Birmingham? I know we're in the middle of UK, but it can't be that the bacteria's just all located in Birmingham. Is there a reason? Does it something to do with the population in Birmingham and the mixture of population?
Really good question. And it's not like the TB bug prefers Birmingham to any other city. I think it's simply down to the people who live in Birmingham. If you look at Birmingham, it's one of the most diverse cities in the UK. And one of the reasons we've got a high rate is because a lot of the people who live in Birmingham were potentially born abroad and have come over to Birmingham from countries where TB rates are higher. Specifically, the South Asian community, we know in India, Bangladesh, Pakistan, in these countries TB rates have been high for a number of years, and people who move over from those countries are at high risk of getting TB in the UK. So it's one of those bugs you could be exposed to in India, for example, and maybe 10 years later you're in the UK, and that's when your TB starts.
Oh, really? So it doesn't start straight away?
Not necessarily. So it's a very interesting...
So it can be dormant?
Absolutely. And I think that's the term, that's the right term to use. It can be asleep in your body, dormant in your body, and it can activate later in life. And that's not to scare people. Certainly for most people it stays dormant, if it is dormant. But I think that's why TB is a bit of a mysterious disease, isn't it? Because sometimes people say, well, I don't think I've been in contact with anybody with TB recently. I don't know how I got it, but it could be that you were in contact with somebody a long time ago. And that's why TB is a slightly mysterious condition. And it's something to be aware of, that TB is something that can happen to anyone. And I do say that. You could have been exposed to somebody with TB in the past, many years ago. You may not even remember it. And it may take place further down the line. Now, one thing to reassure people is it's not easy to catch TB, even the dormant type of TB. You have to be with somebody for certainly many hours, usually over a number of days before you can catch it. So you can't catch it by sitting next to somebody coughing on a bus, for example.
Okay, that's reassuring.
You can't catch it, if you're sharing a taxi ride with someone or something like that. Usually it's people who live within the same household. So if you get TB, the greatest risk is to those people you live with immediately. So that's why we're very keen on people who've got those types of symptoms, things aren't getting better, to go and see the doctor to protect the ones that are immediately around them.
We had a lot of TB in Ireland. It was very, very common when I was growing up. And when I mentioned earlier on that test of the circles, I can remember in school they coming to do this test. And there was a lot of TB hospitals, and there were still, actually up to recently, I don't know if they're still vaccinating babies on birth against TB. So is this something that happens, the vaccination happens here in the UK, or is this something that we now, because we don't hear very often, that we don't really vaccinate, or is it something kind of more focused on different communities, as you mentioned earlier on, communities coming from abroad, that they can have it dormant?
Yeah. So what we do in the UK is, for those communities who may come over from abroad, if they're from certain countries where TB is high, we do offer screening tests to see if they have that dormant type of TB. Screening for everybody?
Not
for those who come in from a certain countries where the risk of TB is high. So if you've come from a country where there isn't much TB, say it was New Zealand or something like that, you wouldn't necessarily get screened for TB. But if you came from, say, countries like India or Pakistan where TB rates are higher, those who will move into the UK will automatically be offered screening tests on arrival. So that's something to always comply with whenever you're asked to come for screening by a doctor, whatever it's for. It's always useful to go. What we do in terms of vaccine in the UK is a little bit different to what we used to do. So in the 50s, a while ago, we used to actually vaccinate children against TB. What we found, though, when the rates went down was that by doing the vaccination, we weren't really achieving as much as we were before when the rates were a bit higher. Because, of course, vaccines do cost money. They do have some potential effects on side effects, but generally they're very, very safe. But I think the real argument was, well, is it worth doing the vaccine if the rates aren't quite high enough? So our health department produces very specific guidance on when we should use vaccine and what groups we should use it for. So instead of just using on every baby that's born in Birmingham, we actually look at if there's any risk factors for babies born to see whether they actually need the vaccine or not. And that could be based on where parents were born, for example. If they were born in a country where TB is more common, they may be offered the vaccine. Other risk factors around whether the baby is particularly at risk of infections or has any other problems medically. But really, I think that's down to the clinical staff to decide. But it isn't something we really do for everybody anymore.
Well, that's good that you're more targeted now. And that people, and I like when you say that everybody is offered this when they come into the country. This is something really preventive for their own health, to go to their doctor when they do come into the country. I wonder how many people that are new into the UK actually take that as a priority, register with their GP and take up the offer of this screening.
Absolutely. I mean, registering in a new country is obviously always a very complicated process, and I can imagine health sometimes can be the bottom of a list of administrative duties and tasks that people have to do, and they may have so many letters and so much paperwork to look at that an offer of a screening test may not seem like the most imminent problem at the time. And when you register with a GP, there may be all sorts of things that you and your family may have to do around vaccination, other vaccines, not just TB, and getting checks and screening, etc. And I think it's always difficult to manage all these different things. But one thing I would say is that whenever you're offered any sort of screening from your GP, whether it's for TB, for example, whether it's for anything around cancers, and it's always useful to take it up, because the idea is by screening for things, you prevent something happening in the future. Finding things early is always better than finding things late. It's better for the individual and better for their families. But certainly not everybody gets screened. I think we just target those that we feel are the high-risk groups. And I think it's important that if you ever do get asked to come for any screening program, that you really consider it strongly.
Great. And that screening, is it just simply taking a blood test, or is it what I can remember in my childhood, or even when I was my children in the 90s, when I was getting them vaccinated in Ireland, they had to go for these tests again and things like that to see this circular thing.
That's right.
I can still remember the circular thing. Is it that? Maybe you can give us a little bit background information. What is this circle? I just remember something like about 12 dots, or it may be less, but it seemed huge to me.
Well, we used to do something called HEAF testing in the past, and there have been so many different tests developed for TB. As I say, it's been a condition we've known about for a long time. There's blood tests that you can use to check for it. You can use all kinds of techniques, and generally what we use when we screen for it is quite often a blood test, but it really does depend on the circumstances, the GP practice that may be offering that offer. But ultimately, whatever you are offered at the moment, if you are offered it, is something you should take up. And we do screening, like I said, for those who come and settle in the UK from high-risk countries where TB is high. But we also often screen, say we get a case of TB, we often screen family members to see if they've got it as well, because they've gone and lived with that particular case, regardless of where they were born. So anybody who's had close contact, we may contact them to say, well, you've had contact with somebody we know has TB, please could you come for a screening? And as I say, if you're ever invited for anything that's screening related, always worth going.
Oh, that's really good indeed. And now when people, you say they offer this to them as they come into the country, and Birmingham is a diverse community for that. If there is somebody that hasn't gone for that and are listening to this program now and think, oh, I've never managed to do that, how can they do that? Is it as simple as actually making an appointment with your GP?
Well, I think it's a really good question. So if you've been invited in the past to be screened, and like I said, not everybody will, it will depend on whether you're in the risk groups or not, and you've missed your appointment or you've not taken it up, then it's always worth getting back in touch. You can just call your GP. And whoever picks up the phone should say, this is my situation. I've had a letter asking me to come in. I hadn't come in before. Can I still get it? And certainly you may be able to, and there's no reason why you can't. So do make that effort. You may have had a reminder, you may not, but ultimately it's very important when you do get these these requests that you do follow them through.
Good. So there's opportunities there, and it could be even for pregnant mums and things like that that they are able to take the screening test, or is that? Yeah.
I mean, checking for TB is certainly not a dangerous thing. Checking for it is just checking for it, and if we feel that there's somebody who could benefit from a screening test, and whether it's because you've been in contact with somebody with TB or you've come from a country that's high risk for TB, etc., then it's always worth taking it. And regardless of your circumstances, there is a safe way of checking for it. And if we find it, the great news is that we can treat most TB as well. I mean, some forms of TB are resistant to some of the drugs that we do use, but the vast majority of TB is quite treatable. So that's the good thing, that we live in an age where we've got good modern drugs that can treat these conditions. And without that treatment, TB can be dangerous if left untreated, not just for yourself, but also the people around you.
Can we explain a little bit more about the treatment of TB? I can remember that a good few years ago now, that TB treatment, I remember when I was working in Ireland as a nurse, it was a lot of medication, a lot of tablets over a long period of time.
That's right.
Maybe things have changed now?
Yeah. Well, I can't say they've changed that much in the sense that it is still... it's still not, say if you've got a chest infection that needed antibiotics, and not all of them do, but those that do, usually you may get your antibiotics for, say, 5 days or a week, and things will resolve. TB tends to be, as I said, it's a bit of a mysterious bug. It does take longer to kill. So in your system, if you took tablets for a week or so, even if you start feeling better, the course that you might be prescribed by a doctor may well be for 6 months or more. And it's really, really important to take the full course. So if you or anyone you know has ever been diagnosed with TB and given treatment, you may find that the treatment's for a certain amount of time, and many, many months is usually the case. And it is very important to fully eliminate that bug from your system, to take it all the way through. What we do know is those individuals who don't take the full course of treatment are more likely to get more resistant forms of TB that then go on not only to get worse, but then stop responding to drugs as well. So taking the full course of treatment is very, very important.
Because you might be feeling well after a couple of weeks and think, oh, that's it, I don't need them anymore, I can throw out these tablets, but actually you could be doing yourself damage as well as other people damage.
Absolutely. It's not an easy bug to get rid of. I mean, like I said, the treatment's very successful, but it does take time. So unlike other infections, it does require that bit of patience, and sometimes there can be a lot of tablets. But I think all you have to think is the reason that we're taking that kind of approach is we just want to make absolute sure that we can get rid of that from your system, and reduce the risk of you passing that infection on to anyone you know around you.
No, that's really important information for our listeners to know, to continue in taking this and not pass it on, because I do know of a lot of people that, get tired of these things down the line and think, oh, I'm feeling fine now, what's the point of doing this?
Yeah. That's right.
And so could it kind of hibernate again in your own system, if is that the right word?
Generally not. Once you've been treated, although it's not completely out of possibility, you don't tend to get TB again. So once we've found it and once we've treated it, your chance of getting TB again are almost zero, but there's always some risk. But I certainly don't think that's a risk that people need to worry about. So if they know someone who's been treated for TB and has been fully treated, they do need to see that person as essentially infection-free. And I think really, once you do get treated for most conditions, infections, they don't tend to come back. The only problem is if you don't fully treat yourself, that's where things can go a bit wrong, and you may get a further relapse down the line. What we find is when people take the full course of treatment as prescribed, the results are really, really good.
Great. Well, we're going to go into a commercial break now, and we're definitely coming back, inshallah, after this break, where we have a few more questions that we'd like to ask you about TB and about the causes and the prevention of it. So, listeners, do keep tuning in to us after this break, inshallah. Assalamu alaikum. Assalamu alaikum. Welcome back to Unity FM, to Parenting Hour on 93.5. You're tuned in to Kathleen Roche-Nagi, and thank you also to our listeners in Luton and Milton Keynes who are tuned in on 105.1 Inspire FM. This evening we've had a very good discussion so far with Dr. Ankush, telling us about TB, what it is, why in Birmingham it's higher than in the UK because of our diverse communities. And we were talking about going for screening and how we should be going for screening, the importance of doing that. And we just finished before the break a little bit about the treatment of TB and that people were on antibiotics. And I'd like to ask you a little bit more about this treatment and antibiotics. What are they? Is everybody given antibiotics if they are diagnosed with it? Is that a standard?
Yes. So if you are diagnosed as having TB, if your doctor thinks you have it, then you do need antibiotics to get it treated. And I think one of the concerns that you'd raised was that people often don't like taking too many antibiotics, and certainly with TB, it is one of those conditions. One is not enough. So if you are diagnosed with TB, you're likely to be on, up to 4 antibiotics. That you may have to take for a period of 6 months or more. Even if you have the sort of dormant form of TB, it still may be 3 months or more. So it's certainly something that does require some intense treatment. But having said that, most people do tolerate any side effects, and the result of getting rid of TB certainly makes you feel far better than avoiding any side effects, certainly. So untreated TB causes a lot more grief, I think, than the side effects usually that maybe for some worse than others, but usually well tolerated from the medications.
Great. And when people are on this treatment, do they have to stay in hospital for the whole 3 months, 4 months that they're on this treatment? On the antibiotics? That's
a good question. So I think most listeners will be happy to hear that you don't, and no one really wants to be in hospital for 6 months. And unless you get very severe or resistant types of TB, which are very rare. So generally you could be treated at home, and you'd have to attend certain clinic appointments just to have certain things checked to see whether everything's working fine, that your TB is actually resolving, just to check whether the drugs are doing the job they need to. But apart from some clinic visits, really it's just a case of staying at home, taking your medicines, and it's not that you have to stay at home and you're not allowed to be out in the community because you might cause an infection.
Yes, exactly. Can you go to this festival that's
on? Right. That's a very important question, and I think people shouldn't worry about that. Certainly in the early stages when you're diagnosed with TB, you may need a period of a couple of weeks, say, roughly, when you may have to say a little bit more within your own room with an open window, say, just because at that stage you might be more infectious. But we know that those who take the medicines as prescribed, after a couple of weeks, usually can't pass that bug on to anybody else. So even though they have to take the treatment for 6 months maybe, after a couple of weeks, their chance of passing it on to anybody else with having taken the treatment up to that point is virtually zero. So they find that they can live free lives and live life much the way they were living but really it's just important to keep taking those medicines. Like I said, even if you're getting better, you're feeling better, if you stop, there's always that risk it will come back. So we do prescribe quite a long course.
And you mentioned there in the first couple of weeks that it's advisable to stay in the bedroom, maybe with the window opened. What about if you're a member of family? You know, we have extended families, a lot of people live in extended families here, and it may be one member of that family that has it. Do they not see their family for the whole 3 weeks, or can they give cuddles to their children or grandchildren, for example?
It's a very good question. You know, certainly, like I said, TB is not something that you can catch, you know, talking to someone, sitting next to someone, even sharing cutlery with someone. So there's a lot of things people worry about, that, you know, if I have TB, I'm not allowed to talk to anyone or see anyone. It's certainly not like that at all. Like I said, for the first couple of weeks, you may have to limit to some extent how much time you spend in close contact with family members, because it can take a little while for the treatments to stop the bugs sort of from passing from one to another. But after that, after you've taken your treatment for a certain amount of time, you'll find life may well go back to the way you've always remembered it. And even while you're on treatment for those first couple of weeks, it's not like you can't, you know, see people or talk to people or give them a cuddle, etc. Like I said, you're not going to give somebody TB by, you know, these sorts of interactions. It's only where you spend prolonged time with people over a course of days. So yes, in the initial stages, you may not spend 10 hours a day, 7 days a week with somebody, you know, like your young infant, for example, or young baby. But at the same time, after being on treatment for a couple of weeks, when the doctors feel that your risk levels have gone down, you'll find that for the most of the course of your treatment, you'll be living a very normal life, and you won't have to be sort of isolated away in any way or kept away from anyone. So, as I said, it's not something to fear. It's not something that puts you in hospital away from all your loved ones. And it's certainly something that can be treated. And so there's a lot of positives to be taken from getting yourself diagnosed and treated if you've got it. If you think anyone's got it, do encourage them to seek some advice. As I said, it may not be TB, but anything that persists, if you've got a cough that isn't settling, you should always think about it and certainly get it checked out.
And you know, that cough that isn't settling, and we're telling people to go for diagnosis, and we're saying that with a blood test, how is it diagnosed? Is there other tests that can be done as well to diagnose this TB?
Yeah, so let's say you presented to your doctor with all the sort of symptoms of TB and they've been going on, and your doctor suspected that you might have it. They would offer you a series of tests to see whether you've actually got TB. One of the commonest and most important tests is actually to test you know, what we call phlegm, which is the sort of back of your throat, sort of gunky stuff that you can spit out, cough out into a pot, and that pot gets sent to a lab, and there we look under microscopes to do various tests and actually see whether we can see any of the bugs that cause TB. If it looks like on that test that there is potential TB, you may get a whole host of other tests offered to you as well. Chest x-rays, sometimes we might take samples from the lung itself using various techniques, but it isn't something to worry about. They're not certainly dangerous tests, and quite often it can be quite a quick process. It doesn't take months and months to diagnose it. The turnaround's quite quick. And once it is diagnosed, once we're sure it is, your care would then be under a specialist who deals with TB at a chest clinic. So it wouldn't necessarily be under your GP, but your GP is often the first person to help you, you know, help pick it up and get you referred on to somebody who can actually diagnose, manage, etc., and get you on the pathway that you need to be on.
Great. So there's diagnosis there that is quite straightforward diagnosis from the sputum and recognising what it is. And would that be done through your own GP, asking for some sputum first?
Yeah, I mean, it certainly may well be. It may well be done by your GP, but depending on you know, other tests that they may arrange, for example, chest X-rays, etc., you may find yourself referred on to a specialist at some point. And I think really the most important thing is getting yourself to the GP. From there on, you know, whoever does the testing and treating, you will be on that pathway where you can get the support that you need to make sure that you're counselled about TB, that you're told what it is, why they're testing for it. And it does, I guess, involve that assessment from your doctor first, when you come in with those symptoms, to think, well, is that what it is? So the first thing is they have to suspect it as well, and in their own professional opinion, if they do think that there is a risk that it's TB, they'll certainly tell you more about why and what they need to do. So rest assured you'll then be in very good hands.
Do you think that in our community and communities that are, especially here in Birmingham, with mixed communities, and that there may be some sort of a stigma associated to this, to people coming forward in the first place, because our family will be labelled and this disease, and because people don't quite understand it, and they'll think, oh, nobody will want to get to know our family down the line, and my children won't get married, and build up the reasons why not to even go and have a test in the first place.
Again, it's a very good point that you raise, and we certainly do know historically people have often connected TB as perhaps being something that maybe needs to be looked down upon, and it's not something that we can say didn't happen, but certainly what I can reassure people is that the thinking on TB has changed, and not necessarily everybody has the same view, but most people now see TB as just another infection. It's an important infection, and it can happen to anyone. I mean, we've had an ex-UK cabinet member, politician with TB. We've had famous singers with TB. I'm not taking any names, but certainly there's anybody can get TB. It doesn't just happen to specific groups of people, specific ethnicities, or specific people from certain countries. It can happen to anyone. No one's got special defences that can stop them from getting it. It's just more common in certain communities because of historically there are certain countries where those communities may have come from where TB rates are higher. And certainly there'll be infections that are higher in different parts of the world. TB happens to be one that's higher in parts of South Asia, Southeast Asia, Africa. So therefore people from these communities often see higher rates of TB. But if you look at other infections, you might find higher rates in different regions. It all depends on where that comes from. So I do urge all viewers to just see TB as any other infection. And certainly if you had any other infection, you'd go to your doctor and say, well, I think I've got an infection. And nothing's different about TB. And certainly if you've got a condition, it doesn't mean that everybody has to know you've got it. Ultimately, we work in a health sector that's confidential. So if you are worried about these things, and you've got TB, and you don't want, you think you've got TB, and you don't want anybody to know, well, ultimately, if you go and get yourself tested, no one's going to go and specifically say this person has TB and tell your entire community or anything. But certainly those who might be in close contact may be aware that they've been in contact with someone with TB. No names have to be used, but that's just to protect those who may have been in contact. And as I said, that's usually those immediate people that live with the person. It's usually not the people they tend to work with or may share a bus into work with, etc. And ultimately, it's not easy to catch TB, but we do need to make sure those who are potentially sitting with TB, thinking about TB, not sure that they want to see their doctor, go and make that decision to do so, because that's the best way to protect themselves and their immediate family.
Because nowadays there's a lot of offices that are open plan offices, and people may be worried of that stigma there,
that's right.
Because of that, that my work colleagues might pick up this infection or whatever. So,
I mean, these cases are always handled very sensitively on a case-by-case basis. Certainly, as I said, most of the time, TB screening is just for those contacts that live very close, or in the same house often as the person who has TB. Very occasionally, if TB has been left undiagnosed for a long time, we may actually need to look at, say in open plan offices where people work for long periods of time, a few select individuals, and not the whole office necessarily, who may also need screening. But again, if that were the case, and I'm not saying it is in most cases, but if it were, it would be done very confidentially. It wouldn't involve disclosure of your name. And generally, if you approach a contact of somebody who's been in contact with TB, the health service don't say, well, who it was. They'll just say it was a contact, and therefore you need screening. So we always do our utmost to protect confidentiality. And as I said, that feeling around stigma for TB, etc., isn't there in the same way it may have been in the past. And I would urge everybody to see TB as just another infection, an important infection, and if they're worried about it, it's something that you seek advice for.
Great, that's wonderful advice. As we're moving into the last section of the show, I would just like if you have a chance to talk about a mum at the moment. I'm thinking of scenario, mum at the moment is pregnant, going in to have her baby.
Yes.
Is this something that she should be aware of? What should she know? Could she be offered this? We have mums from different ethnic groups, and we have going in at the moment to deliver here in Birmingham. What advice would you give her? What advice will she be given?
That's right. Well, it's a very good question. So, if you are about to deliver and you're wondering whether your baby will be offered this vaccine or not, well, the staff at the hospital have to ask themselves a few questions. So, as I said earlier, the vaccine is offered to babies which we put into a slightly higher risk group. So it's not offered to all babies, but those babies who are born to one parent or more, who are from a country, or born in a country themselves, which has high rates of TB, then they'd be offered that vaccine. Also, if a grandparent is born in that country as well, they'd be offered that vaccine. So it really depends on, I guess, really where you originate from as well. So it's not necessarily that you were born abroad. It may be that you're born abroad in a country which doesn't have high rates of TB, and your baby may not be offered the vaccine. So it all really is, it's a nationwide approach really to vaccination for TB. As I said, it only is for risk groups. It's not like a lot of other vaccines that all babies get. So I think if you are born abroad, or your parents were born abroad and you're about to deliver, you may well be offered that that vaccine that we call the BCG vaccine. And
is that a once-off injection for babies?
It will be.
Yes.
It will be, and if required, there might be another vaccine later on in life, and I think that all depends on the health pathway and the risk that's considered further in life. So, as I said, with any offer of vaccine, it's always useful to take it up. It is only for the highest risk groups, so you may or may not be offered it, but if you are offered it, it's well worth taking.
Great. So we've covered quite a lot over this hour in the show, and I think we've given our listeners a lot of information. Maybe we could, in the last few minutes left, condense it down to the real important things that we'd like our listeners to focus on, to know about, even going back to our signs and symptoms originally in the beginning, where we talked a lot about that. If you can just kind of go over that very condensedly in a few minutes, if you can. Thank you very much.
Well, I'll try and give you a sort of concise summary of what I think are the really important points for us in public health services. The first most important thing is to recognise that TB does exist in the UK. It is a bit of a problem in Birmingham. We do have higher rates here than elsewhere, and it's very important to be aware of the signs and symptoms. So I'm just going to go over that list.
Yeah.
Okay. So the list of symptoms that you should worry about: a cough that lasts for more than 3 weeks. And that's the first thing. A cough that doesn't resolve, lasts for more than 3 weeks. That in itself is a reason to see your doctor. What you may get with the cough as well, that might make it more likely that it is TB, are night sweats, high fevers, some weight loss, extreme tiredness, and a lack of appetite. So we see these things as well as the cough with TB quite often. And like I said, you don't always get TB in the lungs. So some types of TB don't actually cause a cough. So while I've said that if you've had a cough for 3 weeks, go and see your doctor, be aware that if you are unwell, if you do have night sweats and fevers and you've been having them for a while, there's no reason not to see your GP, because it's something you're worried about. So in general, with any health condition you're worried, you need to see your doctor. But specifically, the type of TB that affects your chest can cause a long cough, and that's what one of the key messages I want to get across is: if you've had a cough for 3 weeks, it's not got better, you haven't seen any doctor about it, it's not something you've been experiencing before or told about, given the reason for, get it checked out. That's one big thing. Secondly, I would urge everybody to see TB just like other infections. I know it's different in the sense that you need longer treatment, it does take a lot of antibiotics. It has in the past maybe been associated with certain groups of people, types of people, but certainly it can affect anyone. And awareness is the most important thing. And certainly if you are diagnosed, it isn't something that everybody has to know about. The most important thing is that you're treated, and anybody close to you who spends a lot of time with you would then get checked and screened as well.
Yes, we spoke quite a bit about that, so it's not that isolation and
Absolutely.
you're not going to be stuck in hospital or
Yeah.
even locked up in a room and just getting a tray served to you with food.
Absolutely.
And it's not like
and
that.
that kind of thing is something I can really understand people worry about, because nobody wants to be out of life for 6 months, and it's not like that. The treatment might be long, but actually you can start feeling pretty good pretty quickly and living a very normal life. So as I said, I do urge all our listeners to try and recall those signs, symptoms, and look out for this condition. But I know it's a lot to take in, so I do have a web address which I think is very useful.
Yeah.
It's our national source of information for patients on the NHS website. So if you would like to learn more or go over anything that I've spoken about today, all the resources are available on www.nhs.uk. So that's www.nhs.uk.
Yeah.
And as soon as you get on that website, just type in the letters T and B into search engine as your first result, and you'll find a whole host of resources on TB, information for patients, or information for just the general public or family of anyone diagnosed with TB, and that can give you a lot more information.
Super. And is there anywhere people can pick up leaflets? Because maybe somebody's listening in here in Birmingham and may have a relative in Bradford that they thought, that sounds like they've had a cough now for a while, and maybe they haven't heard about TB. Is there leaflets they could pick up?
I mean, there's so much TB information out there, and I know there's certainly many GP practices that have leaflets on TB, especially in areas where TB is higher, where the GPs are trying to raise awareness of TB. As I said, the website does have a whole host of leaflets and other resources which can be printed off and accessed online. So I think those are the two main sources. Your local healthcare provider and your GP, you could ask them for more information on TB, and certainly they should have a whole host of resources for you. But there is always that web address as well.
Brilliant, thank you. Can you just mention that web address again before
Okay,
we
yeah,
end?
no problem. So it's www.nhs.uk, and if you search TB, just type in the letters T and B, you'll get your top result, and that'll give you all sorts of information and guidance on TB.
Super. Yeah. Thank you so much, Dr. Ankush, for that information. That's really useful, and I think together as communities here listening to this show, we need to stamp out TB. We need to raise our awareness that it's not a huge illness that cannot be treated. There is simple diagnosis, simple treatments there, maybe for longer periods, but we can manage this, and this is the message that I know you're trying to get across today, which is good. And I think if we work together as a community, listening to this, coming together, working together, helping each other, we can definitely reduce that.
Absolutely, that's a great attitude.
Brilliant.
Thank you very much, Kathleen.
You're welcome. Thank you for coming to the show and giving up your time on this. We look forward to having you back very soon, hopefully, where we're going to be talking about other public health issues that people should know about, because I think these programs are very informative for people to understand about public health, their own health checks that they maybe come up in the future. We can talk a bit more about health checks, female health, men's health, all of these issues we have in our communities, and people maybe not know about them and not know what services are there, what's available for them. And this is why I want to focus on the next few weeks on public health. So please, would you be willing to come back to us again in the future? And
certainly, Kathleen. Anytime we can find for you in public health, I think is well used. So do invite us again, and hopefully we can talk about some other interesting topics.
Brilliant. Thank you so much. Thank you for coming into the studio. Thank you, listeners, for tuning in today. And inshallah, do tune in to us, as we said, next week and the next few weeks, where we're focused on public health, inshallah. If you've got any questions or any queries or any information that you'd like to know about public health, please email the studio at studio@unityfm.net, and we can pass it on to our experts, and who can have their answers ready specifically to questions for you if you've got issues about this program or any of the future programs, or anything about public health that you'd like them to talk about on the show. So please email us at studio@unityfm.net, or you can ring in the studio at 0121 772 8892 and leave your questions there also. And that's for our listeners also in Luton. Please do email in if you've got any queries, any questions, and if you don't want them answered anonymously on air, we can get back to you and answer them individually also to you. Until next week, have a good week, inshallah, and look after yourself. Keep healthy, inshallah. Assalamu alaikum.
زاد على الناس الشر، إن حل ظلام أو عصر، أو زاد على الناس الشر، نستهدي نورك يا بدر، أمحمد حبك يجمعنا.
الحب فؤاد الصبر، وطوبى للقلب النور حوى. الحب فؤاد الصبر، وطوبى للقلب النور حوى. إن فرق بين الناس هوى، مولاي مولاي فحبك يجمعنا.